John is a 45-year-old male who's here today for a worsening head cold and cough. He has the usual signs and symptoms of an upper respiratory tract infection, and you end up diagnosing acute bronchitis. His past medical history is negative except for 1 or 2 bouts of acute bronchitis every year. Otherwise, his history is negative. He started smoking when he was 18 and smokes 1 to 1.5 packs per day. Additionally, he drinks about 3 to 4 beers per week. He denies vaping or illegal drug use. You ask him about his smoking and his interest in quitting, and he says, quote, "Yeah, everyone tells me to quit. My wife, my kids, everyone. I'm not sure where to start. I've got my blood pressure, my cholesterol. I know a lot of people think smoking's bad, but I just don't know if I'm ready to quit." Hi, this is Frank Domino, family physician and professor in the Department of Family Medicine and Community Health at the University of Massachusetts Medical School. And joining me today is Dr. Susan Feeney, coordinator of the Family Nurse Practitioner Program at the University of Massachusetts Medical School, Graduate School of Nursing. Good morning, Susan.
Good morning, Frank.
So smoking continues. Smoking is a challenge. It's a highly preventable risk factor if we can get people to not start. But once they start, it's hard to get them to quit.
It is.
What's new in the world of research regarding brief smoking cessation interventions?
Well, it was very interesting. There was a study out of Hong Kong that looked at about 1,600 people. 88% were male, and about 47 years was the average age. And what they did is they went to multiple ERs in the Hong Kong area, and they randomized folks into a control group and to a intervention group. And the intervention group, they had a 1-minute intervention using what we call this award, which is similar to the 5As, but an award model. And basically did a quick intervention, asking them also in that period of time whether they wanted to quit immediately or if they wanted to quit progressively with a 6-month, quit date in the future. And what they found is that they had a 50% reduction at 12 months. And they measured it with biochemical measures. They looked at, carbon dioxide and various other things in saliva and determined that, they not only got the subjective information that these folks had quit, but they actually had biochemical evidence that they had quit. And along with that 1-minute intervention, they did 4 follow-up phone calls, which were anywhere between a 1 to 2 minute phone call over that period of time. And I was really interested in this because this is a dilemma. This is a problem that we face every day, and we see patients time after time, and sometimes we sort of feel it's futile. And, we say, we're going to talk about smoking cessation, not interested, and then we leave it alone. But this was kind of a pretty direct approach, and I thought it was very interesting.
It is interesting. So you mentioned the 5As. The award acronym, can you explain what award stands for and what self-determination theory is?
Sure. So the award acronym is the A stands for ask. What is your past smoking history? So for our guy, John, it would be that I've been smoking since I was 18 and I smoke 1.5 packs a day. And you may want to ask, any other history? Have you tried to smoking cessation in the past, and have you had any success? So that's the A. The W is for warning, and what they did is they made a quick statement, from the World Health Organization that basically said, and they said the same thing to everyone, that the WHO warns that 1 out of 2 smokers will be killed by smoking. Recent medical research has shown that those who started smoking at a young age, 2 out of 3 of them will die from smoking. So they gave the same risk and sort of didn't, honey-coated. That was done for everyone. And then A was advise. So that was if the people had decided, if they had decided to quit immediately, they said, congratulations, here's the hotline, here's a brochure on support. And if they decided to quit progressively, they were given advice on how to cut down, like 15% the first week, then 30% over the first month, and then 50% by 3 months with completing complete cessation in 6 months. And that is based on the self-determination theory. So the A and then R is refer, that they referred them to the smoking hotline, and they said, please call, go to that hotline and get the information to help support you. And then D was you would repeat this if you saw them again and they were still smoking. So it was, this repeat kind of thing. But the self-determination theory is the concept is the that people seem to change behavior better when it is internally motivated as opposed to external. Like I told the finger wagging, the provider or the parent, when they're given choices, like here's your options, you make the decision. And the way they worked this out was, okay, you want to stop smoking, or it appears you want to stop smoking. What would work best for you? Immediate cessation, or gradual cessation over 6 months.
So I'm not sure that it would work in my practice to be so direct.
Yes.
But I do think the idea of saying to patients, I really think you ought to quit. Do you want to try to quit now, or do you want to try to quit in the future, or do you want to quit gradually over the next 6 months, is a very interesting way for me to phrase my interest with patients, because I think many people who smoke on some level probably would like to quit, and we're offering that, we're giving them choices that may really open the door to them. There is a subset that don't want to quit, I realize that, but many people probably do, and offering them this very direct opportunities, it's kind of a novel approach.
Right, and I think that studies have shown that most people who smoke aren't, really wish they had started. And I think what I would, using this model is, like you said, may not work in your primary care office, but you certainly could have the initial discussion with maybe some of the support staff, could do that with the patient. And then even the follow-up concept, the follow-up phone calls. Hey, how's it going? Do you need any help? I mean, we know that we've got other lifestyle management or changes that studies have shown that actually does help, checking in on weight loss or blood pressure control. And so what I might say to Anthony is, look, I know you're not really ready, but I'm going to tell you that that smoking is going to have an impact on your health. There's no question, even though you may not see it now, that it will either cause a disease or worsen a disease. That's a certainty. So smoking is something that would really be a great idea that you gave up. So how would you like to look at this? Do you want to think about it and come back and talk to me? Would you think smoking immediately would be in your best interest, or do you want to stop smoking gradually? And if that's the case, let's talk about that. Let's talk about I used to tell patients, take 1 cigarette out of your pack a week, and then the next week take 2 cigarettes out, and then slowly get used to smoking less with a quit date in the future. And also making sure that they have access to some of these supports. Like the CDC has a wonderful quit line, and Massachusetts has this wonderful, make smoking history, 1-800-QUIT-NOW, number to call that does give people a lot of support.
I think probably those last 2 points you made are the biggest takeaways for me, is that A, this study used hotlines. They didn't rely everything upon us. And the other is being pretty firm about, I want you to quit. Do you want to quit now or quit later? So I like the way you've taken what this study did and crafted it for your unique approach to patients. Any final thoughts on what you might say to Anthony today?
Well, I think just, again, reassuring that, I know you feel good now, and I know it's terrible, you just hate having people harp at you. But the truth is, we know that this is a damaging habit, and it's going to hurt you in some way. So let's figure out together what's going to work best for you. And I understand that this is a process, and you may quit, and then you may restart, and that's okay, and we'll work on this together, and you've got all kinds of supports. And this is a judgment-free zone, and, you can decide to come back in 3 months, and we can talk about it again. But, sometimes what we do is perfunctory. I got to talk to you about smoking. Okay, fine. You don't want to stop, fine. That we just need to be able to, make it like this is a concern. And I care about you, and that's why I'm asking. But I want it to fit who you are and your pace, so you're successful.
Thank you, Susan.
Thank you.
Practice Pointer, advise smokers that they should consider stopping now or stopping gradually in the future, and offer them help, including your support as well as hotline information. Join us next time when we discuss 5 tools we can use as clinicians to improve patient communication and improve our own professional satisfaction.